So this is a demonstration of what is called an IVC filter for inferior vena cava. These are designed to go into the inferior vena cava and expand to trap and destroy clots when patients can't go on an anticoagulant therapy due to several reasons. And they have recurrent DVTs that we're worried about getting into the pulmonary arteries, the heart, or any other places. The actual filter is in this device with an arrow pointing to jugular if you're going IJ access, or femoral if you're doing femoral access. So the actual filter is in here. We'll pretend that this is going towards the patient and this is towards the table. Here we have our sheath and introducer. So very long sheath here that goes all the way down into the internal jugular, to the SVC, through the heart and into the IVC, and then we want to go just inferior to the renal veins, and this is the pusher mechanism here that pushes it through. So you get this down into the patient and get ready to preload your filter. Put your pusher in there. So now you've got it preloaded. Can go ahead and place it then into the inner part of the sheath. Actually, correction, you need to take out this inner part of the sheath first. Once that is out, then you can actually connect it. So we'll back it out a little bit there. Plug it in, makes a little snap, and it's pointing jugular. So there we go. Now we're set. And you watch on x-ray as this goes down. It has a radio opaque tip, so once you get down to the spot you want, you put it right there and then start feeding through. So now we're going to push that catheter out, or the pusher through the sheath, and at the end you'll start to see here momentarily the IVC filters start to emerge. So we're going to keep going here. All right, so we've got our pusher starting to come out, which means the filter's right about there. And here's the start of the filter coming out. And we'll start to push it, and it'll start to deploy here. And once we know we're in a good spot, push it all the way out. And we deployed our filter. Now we can backtrack everything out. And we deployed our filter. And this is an IVC filter. They can spread out a little bit more, of course, but it sits like that in the IVC and catches anything that comes up. And has this little hook at the top so that once the need for anticoagulation or clot busting therapy is done, we can go in with a hook and loop and retrieve this and suck it back up. So it's designed to be retrieved after all is said and done. Hope you enjoyed it, and just a little bit of what we do here in interventional radiology.